Now we have Anna from Nova TV in Croatia. Anna, are you on the line?
Yeah, I'm on the line. Can you hear me?
Yes, please go ahead.
So as you could hear these days, Oxford experts said that Croatia has one of the most strict measures when it comes to number of cases. We have less than 1,000 cases right now. I can see that this is changing our lives. So I wonder if you have any idea for how long this COVID-19 epidemic can last. And is there any proof that higher temperatures can stop or slow down spread of this novel virus?
Thank you. At this point, no one can predict how long this epidemic is going to last. And there are a number of scenarios that take us forward in time. I think the other question people are asking beyond how long is the pandemic going to last is how long are the shutdowns, how long are the lockdowns, how long are all the measures going to last, and will these measures be changed or be different? We are moving through an uncertain future. You see many countries around the world are just beginning the cycle of this epidemic. Some have been through the cycle of the epidemic, like Singapore and China, and are now desperately trying not to have the disease re-emerge and cause another wave of infections because of disease importations. So each country is in a different position, and Croatia is probably in a different position to many other countries in Europe right now. The real trick for countries is to look at the national situation, to look at the subnational situation, to see if you know where the virus is. If you know where the virus is, you can break the chain. If you know who has the virus, if you know who the contacts are, you can break the chain. If you have that knowledge, and if you have that knowledge at subnational level, you can only take action at the level at which you can measure. If you know what's happening in every town, if you know what's happening in every municipality, every county, every province, you can then begin to adapt your measures for the situation in that particular area. And all of us want to see the measures that we're using for public health at community level to be adapted to the maximum control of the disease, but to the minimum impact on economy and social life. And in order to do that, and in order to transition from the current measures that are in place, countries simply have to have in place a system to detect, isolate, contact trace, and quarantine, as well as to continue appropriate hygiene and physical distancing measures. They must be in a position to do that in different parts of a country at different times, and they must be in a position to re-implement measures should the situation deteriorate. That takes a very sophisticated surveillance system. It takes a very strong health system to absorb the surge of cases in any particular area. And what we need to do now is evolve from measures that have been designed to suppress and just take the heat out of this epidemic or pandemic to much more precise, targeted, directed measures that will allow us, at the very least, to live with this virus until we can develop a vaccine to get rid of it.